Welcome, everyone. We are back here again with Dr. Harvey Joanning for the Neurobiology of Relationships, Part 2. If you were at Part 1, you might remember he introduced both the neurobiology of the brain and of the endocrine system to us. I will put the link to the YouTube of the last one in the chat in a second, but he'll go over where we ended off so that you can get caught up. But I will hand it off to you now.
All right, thank you. Welcome back, those of you who were with us a couple of months ago. For those of you who were not with us, I'll take just a couple of minutes to highlight some of the things we talked about last time. But I would encourage you to watch the YouTube video of the first session and to read my paper, which you should have a copy of, the Neurobiology and Treatment of Relationships, a paper by the same name as this presentation today. So what I would like to do is just briefly review what I talked about last time. I went over the 7 primal brain circuits in the human brain. These have been well documented by neuroscientists over the last 30 or 40 years. And these brain systems are what drive much of human behavior. So in this chart, you'll see on the left side the names of these 7 brain circuits: seeking, rage, fear, lust, care, panic, and play. You are not consciously aware of these circuits ever. They're deep in your physiology. What you're aware of is your brain taking these primal emotions and interpreting them given the context of what's happening to you at the moment. So, for example, rage, anger might be experienced as a feeling. An emotion is different than a feeling. I know most people lump them together, but a feeling is an interpretation of a primal emotion. A primal emotion is a biological reaction to the environment at any instant in time. But your brain takes that biological reaction, literally and figuratively looks around to see what's going on to make sense out of that emotion. So the same emotion can generate many different kinds of feelings. So feelings are a higher level, are a more complex interpretation of a biological process in the body. So for example, lust, sexuality, the common term is being horny, whereas rage, anger, we talk about being irritated or pissed off. So I talked about this in great detail last time. So again, if you weren't with us, please review my paper and or the presentation that I gave last time. This image shows you where in the brain these different levels of processing occur. You have physiological responses bubbling up from your body that come up through the basement of your brain, the paraqueductal gray at the bottom of the brain. The PAG converts that visceral information into one or more primal emotions, depending on what's happening to you. So your body reacts physically, and that information is combined with what you're seeing and hearing in humans. In dogs, it's primarily based on what the dog is smelling. So this sensory information plus your visceral reaction to the environment get combined into one or more primal emotional responses. And again, the seeking expectancy system to the left here in my diagram is the most basic, and it's always running. If it's not running, you're dead. The seeking expectancy system evolved first about 580 million years ago. The other 6 primal circuits literally grew out of the seeking expectancy system over vast periods of time. So these primal emotions then are passed to the center of your brain, the limbic system, which processes those primal emotions into feelings, which are interpretations of those primal emotions based on what's happening to you at any given instant. The limbic system in the center of the brain talks to the wrinkly part of your brain, the neocortex, where memories are stored. so that that information, those memories, can be used by the limbic system to help come up with a proper interpretation at any instant in time. Now, those of you who were with me last time, this probably make complete sense to you, hopefully. Those of you who weren't with me last time probably are lost. So go back and read my paper and listen to the first presentation. This is very complex neuroscience, and I'm trying to give it to you in layman's English so that you can understand it. So I'll be alluding to these primal brain processes during the rest of my presentation today and in any future times that I might spend with you. I'll let you read this for just a moment. Albert Einstein knew a lot about love. He was quite a ladies' man. Most people don't realize that his wife was very long suffering and she put up with his shenanigans. In fact, I find it interesting that a physicist was so keenly aware of love. I was mentioning to our host before we started today that I'm working on a new workshop, and it will be called From Quantum Foam to Neuroscience to Social Constructionism: How Physics and Biology Drive Human Behavior. And it's a much more in-depth exploration of how, at a very deep level in our bodies, our experienced reality emerges. So I take it all the way back to subatomic physics, and I gradually build it up through biology to ultimately human behavior, and I focus on social constructionism, the idea that reality as we experience it is constructed socially as we interact with other people. And that whole presentation is based on the latest thinking in physics. I also have a very good background in physics, especially theoretical physics, and I have a lot of physics professors as friends, so we're always talking about this stuff. If you think this workshop that I'm covering today is weird, this other one I'm working on is really weird, because people have no idea just how strange subatomic physics is. But subatomic physics is what biology is built upon, and it drives a lot of the craziness that occurs in human behavior. All right. If any of you have worked with drug addicts or drug abusers, as I have, you're aware that all mind-altering drugs have a profound effect on human behavior. That's because mind-altering drugs such as crack and heroin, marijuana, they hijack the VTA nucleus accumbens reward circuit that I talked about the last time. This is a primary reward system in our brain that motivates human behavior. And street drugs just jump in and take over that circuit and force it to operate artificially. Not in response to something in the environment, it simply triggers a reward response, even though there's nothing going on in your environment that should make that happen. So these drugs jump in there and do what we don't want them to do. Now, falling in love does the same thing. Huh? Have you ever noticed people falling in love? They act kind of crazy. They do bizarre stuff. It's because this same pleasure reward system is being hijacked by the experience of encountering a person who you find very interesting and might be a potential partner for you. So your brain doesn't function normally when you're falling in love. As we fall in love, as we go through the first stage of love, the romance stage of love, I've got something covering my skin. Hang on just a second. I gotta get rid of that. Okay, so as we first start getting interested in someone, and we have this romantic attraction to them, which is primarily driven again by the lust circuit in the brain in combination with the seeking circuit. Seeking circuit, as you may recall, is the basis of curiosity, and lust is necessary for our species to propagate itself. So when those two come together, you have romance. You get attracted to someone but you're not in love with them yet, you're just attracted to them. And I talked last time about all the different hormones that are driving that attraction. So romance is very addictive, just like taking street drugs is addictive. But the romance stage of love, as you may recall, only lasts a couple of months typically, and it's got to be replaced by the attraction and eventually the attachment stages of love for love to really mature. This is a picture I took in Kenya some years ago of chimpanzees very much in love. Now, last time we didn't have time, but I'm going to play this brief video for you, and hopefully you'll be able to hear it and see it all right. So let's see if our host is still with us. Let's see if this will work. Let's see. I'm going to play it for just a second to make sure you can hear it on your end.
I don't
Can
hear.
you hear it? Let me turn the volume up.
No.
Now
Still
can you
can't
hear it?
hear it.
You can hear it?
No.
All right. Okay, this isn't going to work now. What I've had to do in the past is, tell you what, let me go to the next slide. Here is a link. Can you from your end go to this link and bring it up from your end, do you think?
Let me pull it up for everyone and put it in the chat real quick.
Okay. Let's see if it'll come up. Can you hear it now?
I don't hear anything from your end, but I put a link to the video in the chat.
Let's try it there.
Same one.
Now, this may not work. All right, well, we'll skip it then. This is a cute little song, and I wanted to play it for you if possible, but apparently it's not going to work. Let me see if I can get us back to the presentation. Are you still hearing me okay?
Yes.
Okay. How do we get out of this? Let's see. Let me go to the next page. Hang on just a second here. I'm usually using this with a different system, but it's not working here. Okay. How can I get out of this? Let me see. No, but
In the meantime, yeah, I'm pretty sure I found that video and I put the YouTube link in the chat if anyone wants to grab that.
okay. Well, I'll let you folks listen to it on your own, but I think you'll find it quite fun. Now, my problem is I can't get back to my slide presentation. What is happening here? I'm going to stop sharing for a second and bring it up again. Let's try this one more time. Okay, let's talk about, I am assuming that a bunch of you in the crowd are doing psychotherapy and maybe doing couples therapy or family therapy. So what I'd like to do is talk about what you do if you're dealing with a couple who is in the romance stage of love, or the first stage, either romance stage or the attraction stage of love, and they're just getting into a relationship. And they'll come to you probably for premarital counseling. A lot of times I'll get referrals from churches. They want me to work with a couple to make sure that they're ready for marriage. And then in my private practice, I've had people come wanting premarital counseling. So this is typically what I will do. I've done about 50 years of research now on how to work with couples in general, but also couples in this early stage of love. Two programs that are extremely effective are the couple communication program, which was developed at the University of Minnesota back in the 70s, and it's still going strong, and the relationship enhancement program, which is developed at Pennsylvania State University. Now, what I've done is combine these two programs. I've done a lot of research on making them even more effective. The key thing about these programs is they teach couples to speak from a position of self-awareness. And there are different types of self-awareness. What I think, what I feel, what I want, what behaviors I'm engaging in, what my hopes are for my relationship. These are different aspects of self-awareness that have been researched very heavily by relational psychologists. And so what we do is teach people to speak from a position of self-awareness. Dear, I feel really drawn to you, and I like to be around you because when we're together, we have a lot of interests in common, and you're always very attentive to me. You're always caring and concerned about me, and it makes it very pleasurable for me to be with you. Now that's speaking from self-awareness, and it's speaking from self-awareness. And it's also important that each partner listen empathically to their partner, listen for the emotion and feelings underpinning what they're saying, as well as the content of what they're saying. I do training programs with therapists to teach them how to, in turn, train couples to speak from self-awareness and with empathy. So again, self-awareness includes being aware of what you're thinking in a given instant, what your feeling interpretations of emotions are at any one time, what your intentions or desires are, what actions you're taking, the actions you've taken in the past, actions you're taking right now, or actions you might take in the future to make the relationship better. And we also pay attention to sensory information, especially with what one sees and hears, because that's what your brain is using to make sense out of your emotions. So I spend a lot of time with couples making sure that they include all this information. A lot of men will share a lot of thoughts, but they don't talk about the feelings that they're having or the feelings that they're having. They tend to be emotionally constipated. That is, they think, but they don't share their feeling emotional experience of life very much. Women, in my experience, tend to not share their desires, or they're trained from little girls on to be helpful to other people, but they don't ask for what they want out of a relationship in many cases. So when I'm dealing with couples just getting together, I make sure that they're sharing all this information so that they're fully aware of what they're getting themselves into. So then again, listening empathically, as you learn in graduate school, is listening to both the literal message, but the emotional content underlying that message. So in the reading list at the end of my paper, I give you information on how to get further training in couples communication. I also have in my appendix the communication rapid assessment scale, which I alluded to last time. My students and colleagues and I worked for probably 7 or 8 years. We developed this communication rapid assessment scale, which is a compilation of hundreds of studies that have been done on couple communication. And we've laid it out in a very simple form from +2 to -2. +2 is excellent communication between two people. +1's pretty good. 0 is just exchanging neutral information like, what's the temperature outside right now, dear? -1 is not doing is doing a rather poor job of communicating, and -2 is having a terrible fight, is having awful communication. And we describe those 5 levels of communication in a lot of detail in the communication rapid assessment scale. So by all means, pull that scale out, make a copy of it, and use it. It's the most requested reprint I ever got before we had web pages. All right, so couples are moving from the beginning romance or lust stage through attraction to eventually attachment stage of love, which I covered briefly last time. And if they encounter issues, differences of opinion, or varying preferences during those stages, that has to be dealt with for their relationship to become long-term and functional. So couples oftentimes will show up in my clinics or show up in my private practice because they're struggling. They have differences of opinion about something, and so issues have come up that they're trying to deal with, and they're stumbling. They can't come together to some agreement about how to deal with that issue. So if the issue isn't dealt with satisfactorily, it'll become a problem that will plague them. So we want to do whatever we can to avoid issues becoming persistent problems. So how do we deal with that? All right, there are three models of relationship or marital therapy, couple or marital therapy, that are based, at least to some extent, on the kind of neuroscience that I've been sharing with you. Some of you may be familiar with my old colleague, John Gottman, who is retired now. John and his wife had retired a couple of years ago. They're at the University of Washington in Seattle, and they've developed an approach to therapy called the Sound Relationship House. And John and his wife have done some work trying to integrate neuroscience into their model of therapy. Sue Johnson, who you may have heard of, emotionally focused couples therapy, she is deliberately trying to focus on human emotion. However, Susan's model confuses emotions and feelings. She doesn't follow Panksepp's approach as carefully as I do. So her model can be, to my students, a bit confusing because I've been teaching them all this neuroscience, and she doesn't draw that distinction. Although I've noticed recently she's starting to pay more attention to it because people like me have critiqued her about that. Brent Atkinson, on the other hand, his pragmatic experiential therapy for couples is soundly based on neuroscience. Brent and I have known each other for 43 years, I think now. I was his major professor at Texas Tech University many years ago. Brent just recently retired, but he is the founder and still very much involved in the couples clinic in Geneva, Illinois, just outside Chicago. So you folks are close to his base of operations. Now, Brent's down in Arizona part of the year, but then he comes back to the Chicago area from time to time to visit with his staff. But their model of therapy I really like because it's so based on neuroscience. And they do have training programs right there in Geneva. So you folks in the Chicago area, you can partake in their training. They have online training as well as in-person training. They also offer internships and practica right there at the couples clinic in Geneva. I've been there a number of times. It's a great facility, very well run. This is John Gottman and John Julie Gottman's Sound Relationship House. I'm not going to go into detail about it today. You can read about this on your own. Go to their website. They have all these great little videos, both cartoons and other kinds of videos that lay out their approach to therapy quite nicely. So then they'll walk you through what they do in their model of therapy. Here's more about the Gottman Institute. Their most notable framework is the Four Horsemen of the Apocalypse. Now, John and his wife are devout Jews, so they use biblical references. And the Four Horsemen of the Apocalypse, if you've studied the Hebrew Bible, you'll know what that means. They're using the term Four Horsemen metaphorically. And the Four Horsemen of the Apocalypse, the things that get couples into trouble, are criticism, contempt, defensiveness, and stonewalling. Criticism is when you're really being verbally nasty to someone else and giving them a hard time. That typically sets off an anger or fear reaction in the brain. So it's a terrible way to try to keep a relationship going. You're much better off using what's called a gentle startup. So what I could do is turn to my wife and say, why in the hell didn't you clean up the dishes after dinner? What were you thinking? A better way to do it would say, honey, I'd appreciate it if you help me wash the dishes so that they're not here in the sink. So criticism is very, very deleterious to a relationship, where a gentle startup is helpful to a relationship because it tells your partner, it requests from your partner in specific behavioral terms what you would like them to do differently, or what it is that you enjoy about their behavior that you would like more of. If criticism has been in a relationship for a while, it can lead to contempt. This feeling that I just can't stand this person anymore. And that can lead to all kinds of angst in a relationship and stir up the negative affective circuits in the brain that I'll talk about later today and maybe in a future session. So you want to avoid criticism and contempt in a relationship because that really tears the relationship down. It's better to, rather than be contemptuous about your partner, it's better to build, as Gottman's would say, a culture of appreciation. Being aware of what your partner does that you appreciate and let them know what they do that you appreciate so that they will do more of it. After my first wife and I had a very good relationship. And when she died, I tried to remember everything that made our relationship good. So as I was single and I started interacting with other women, I tried to approach them the same way I did my first wife. And that worked very well for me because I always tried to let other women know of what I appreciated about them. And my wife now, Dana and I met 8 years ago, we were both widowed, and she was struck by how appreciative I was of her and how I let her know what it was about her and her behavior that I really liked. She had been single for a long time as well, and she was really put off by most men because they weren't very appreciative. Defensiveness, generally speaking, is accusing somebody else of doing the very thing that you're doing. That's a little different definition of defensiveness than you usually think of. But if you bark at your partner about doing something that you're really doing, but you accuse them of doing it, that's defensiveness. So the important alternative is to take responsibility for your own behavior and be aware of your behavior, both behavior that your partner finds gratifying and pleasant, and behavior that you engage in that your partner does not like. Now, that doesn't mean that you can only do things that your partner likes. There may be things that you like to do that your partner doesn't like that are permissible, perfectly acceptable behavior in most circles, but for some reason your partner may not like that particular behavior. So this becomes a real struggle for couples because sometimes an individual is used to behaving a certain way with friends. They start dating someone, and that person they're dating doesn't like all the things that they do routinely with their friends. There's something about that behavior that's off-putting to them. So that can be a problem. A perfect example is some guy who goes out and has a couple beers with the guys and comes home slightly tipsy. Well, if the woman he's dating came from a family of alcoholics, she's not going to like that at all. And even one beer might really set her off. So he'll say, well, what's the big deal about having a beer with the guys? Well, you could turn into a drunk. So these kinds of things happen all the time early in relationship development. So as therapists, we need to be very aware of what's setting couples off as they try to develop a relationship. And then the fourth horseman of the apocalypse, the stonewalling. Men are notorious for this. That's shutting up and not talking. And we think it is due to the 500,000 years of hunting experience that male primates have engaged in. I don't know, you ladies may not be as aware of this unless you're hunters, but I grew up on a farm in Iowa and we went hunting all the time. And the old timers tell us kids, shut up, be quiet, let's sneak up on the animals so they don't hear us coming. So we were taught as boys to keep our mouths shut and to keep our excitement under control and be quiet. Well, that can carry over into a relationship. If I'm a guy and I'm around a woman who's really angry at me and she's coming after me verbally, I might just shut up and not talk, which makes the situation worse. I don't know if I told the story last time, but I had a couple show up in my office years ago. This guy was a linebacker. He weighed about almost 300 pounds. He's a huge guy, and he's married to a woman who's maybe 95 pounds. And so they came to my office and I thought, well, this is going to be interesting. And she ripped into him within the first couple of minutes. And he just went into fetal position. He couldn't talk. He was just so overwhelmed by her verbal attack that he closed on himself. He stonewalled, which really made her even more angry. So when you're dealing with people who stonewall, which tend to be men, it's important to help them learn to be self-soothing, physiologically self-soothing, which would be a whole workshop in and of itself. Okay, I think that's before I go any further. Are there any questions so far? And you can use the Q&A function on your computer if you have any questions as we go along.
We have one question in the chat from earlier.
Okay.
Do you want to speak to that, Laura?
Okay. Hello, Harvey.
Hi, Laura.
Hi. You talked about programs for couples, and you're referring to ones that work well, particularly when a program relies on self-awareness. That counts out my clients. I have marriages where one person is neurodiverse and one person is not. So I wondered if you could recommend any programs for that kind of a marriage.
Well, I think you're going to have to improvise in those situations. And I certainly have run into those kinds of couples. For example, I work a lot with Alzheimer's couples. One of the couple has dementia or is developing dementia. So then we have to be quite creative about what we can do to help the person with dementia be self-aware and communicate effectively. So the short answer to your question is you're going to have to tailor what you do to that particular couple situation. There isn't a program I'm aware of that deals with neurodiversity. The programs that I've alluded to talk about people who are your pretty average run-of-the-mill person.
Okay.
That's an excellent question. And do you ever work with people with neurological problems?
Do I?
Yes.
Well, if you're including neurodiversity, that's pretty much the only population I work with.
Okay, tell me a little more about that.
Okay.
What does give me a quick example of what you mean by neurodiversity in your practice?
Okay. People on the autism spectrum.
Okay.
The youngest I work with would be like late high school, but that would be people who have other problems. I also work with couples where one is on the spectrum and one is not. And
yes,
that's a really challenge. It's interesting because I can imagine when you just said you work with people who where one person has Alzheimer's, it kind of starts with nailing down what's possible and what the reality neurobiologically is for one of the couple. The other couple has to be in a position to accept certain information without judgment, and and then they have to work on their own anger. They have, just like regular old parents, when we think maybe our kid is capable of something that they're not, and we get pissed off at them because they don't do what we didn't realize they're not capable of doing. So then we add the anger and we're blaming them and holding them responsible, and it's like that. Another big problem is that for whatever reason, if one of the people didn't realize, a lot of people don't know, haven't got awareness about autism and may not recognize it, and they have the expectations about marriage that include partnership, sharing, decision-making, and, you know, they're entitled to do so. But then a couple of years into it, something's not working out for them because they don't feel like they have a partner. And there's just so many layers. Another
Laura, I think you've
Yeah.
touched on exactly the experience I've had, not only in my own practice, but in our clinics. We'll have people come in, a couple come in or a family come in, and a partner or a family member is neurologically diverse in some way. So part of what we do is educate the partner or the family members about what this is that they're dealing with. We don't label it as a problem. We label it as this person is different. And this is how this person is different. And this is what you need to know about people with these differences. And usually that's a good starting point. Have you seen the TV show, The Good Doctor?
I have, yes.
Have you recommended that to your to couples or families who have a member with autism?
It depends. It also
Okay.
depends on in one case, the husband, the adult, who has family of origin pretty much changed the world to adapt to this individual.
Yep,
The
that's
indiv-
called a problem-determined system. Yeah.
And
So
yeah.
I think we could probably spend a couple hours talking about this, but the point being that you have to recognize what the difference is among with this couple or family you're dealing with, and you have a whole caseload of people who have at least one person in the couple or family who is different, and we always start with helping everyone understand what the difference is without trying to label it as something wrong with the person. They're simply different. Okay.
And you're right, we could talk for hours, so I won't even respond to that.
Okay, well, thank you, Laura. Thank you for your question.
Yeah.
I'd like to go on now and talk about the golden rule. I have mentioned last time, I've spent time in 27 different countries studying family life. I'll go in and spend days with the families in this particular culture to try to learn as much about them as I can. And as part of that, I've had to study all the world's leading religions, because as you go around the world, you're going to run into a whole bunch of, there are about 630 different religions cataloged worldwide. And this slide shows you some of the major world religions. And what you'll find in each of these religious traditions is something analogous to what we call the golden rule. So for example, in the North American Indian, Native American culture, in the beginning, there were instructions. They are to love and respect all living creatures in Mother Earth. Well, that's very similar to do unto others as you would have them do unto you. So in all these religions, this common theme comes through. You may think, well, that's strange. Why would they all have the same general basic belief? We think it's because comparative biologists have studied primates and other social animals, animals that have oxytocin in their nervous system, the bonding hormone. All animals that are social and bond have a variant of the golden rule. So if you're a great ape in the jungles of Africa and you're not nice to the other members of your clan, they're not going to like you. They're going to kick you out. They're going to exorcise you. They're going to do something to get rid of you, because the rule is that you have to treat each other well. This is very true in prairie voles, for example. They're incredibly social animals, and they have a behavioral equivalent of the golden rule. So what comparative biologists have come to believe is that being collaborative and cooperative is necessary for survival of species that bear live children and have to keep their children, take care of their children for some time until the child is old enough to function on their own. Now, we humans arguably do the best job of collaborating. Although you might think, when you watch the evening news, you might think we don't collaborate at all, but keep in mind that what you see on the evening news is the exception rather than the rule. In my experience, in the 27 countries I've been, human beings are incredibly collaborative. When I come to study them, they have always been welcomed with open arms. They're all very happy to share their family life and their culture with me. I've never had anybody refuse to let me interview them and spend time with them. And what I found is that worldwide, people tend to be very collaborative. Now, again, we have exceptions to that, exceptions that can lead even to warfare. But as a general rule, we humans are very collaborative, or we would have never survived as a species. So I just put the slide up because I wanted you to be aware of what I've learned as I've traipsed around the world. Let's see if I can get this slide in forward. Okay, excuse me. All right. Let me spend just a little time summarizing what these different approaches to couples therapy get involved in. Sue Johnson's work is based on attachment theory, the notion that as you grow up in your family of origin, you learn how to bond with your parents. And if you bond successfully, if your parents are loving and caring, you bond to them in a very positive way. But if your parents aren't loving and caring, you're not going to bond successfully with your parents, and that's going to lead to a mess for you in the rest of your life in many cases. So Sue Johnson focuses on helping couples, people in close relationships, learn how to bond appropriately with one another. And so she looks at the attachment style that people bring to the marriage or to the relationship to make sure that they're both bonding in a positive way. Sue has added a lot to couples therapy because of this. She's building her work on the work of Bowlby after World War II. A guy named Bowlby started in 1946 with attachment theory, and he has hundreds of thousands of followers worldwide. It's a very well-developed theoretical notion. So what we learn in childhood about bonding carries forward into our adult life. So emotionally focused couples therapy helps people relearn how to bond with another person if they haven't learned to bond securely in childhood. If you grew up with a parent who is mean and nasty, you're not going to learn how to bond. You're going to be more concerned about protecting yourself from harm. And that, of course, gets in the way of relationships. Generally speaking, couples who come in for couples therapy, at least one of the partners has an attachment issue left over from childhood. That is, they weren't securely attached and bonded to their parents. They didn't learn how to do that as a child. So as a therapist, you're going to have to help them learn that as an adult. Now, recently, as I mentioned earlier, Sue Johnson has started incorporating some of the components of Jack Panksepp's work and other effective neuroscientists' work in trying to understand why it's so hard for people to bond if they weren't securely bonded with their parents. And what she's doing is pulling out of Panksepp's work the notion that a primal fear stimulates the amygdala to react negatively to a partner if a partner is doing anything reminiscent of what the parents did to this person when they were a child. We've worked a lot with this in our clinics. We're trying to monitor the primal brain processes that are dominant in our clients' experience in life on a day-to-day basis. And if they're being ruled by one of the negative affective circuits, fear, anger, or panic, we focus on that and we try to help them relearn how to be in a relationship with other people. And this is very analogous to what Sue Johnson's trying to do in her approach to therapy. Now, as I mentioned, Brent Atkinson, my former student, has developed his entire model of couples therapy on Panksepp's work. So the Couples Clinic has a research division, the Couples Research Institute, which is part of the Couples Clinic in Geneva, Illinois. So what Brent and his team have done is come up with a model of therapy that helps reprogram people to have a healthy pattern of interaction rather than a negative pattern of interaction. And again, what he's trying to do is suppress the anger, rage, the fear, anxiety, and the panic grief circuits, and replace them with the positive circuits, caring and playfulness and lust and curiosity. I don't have time to go into that here today, but I would encourage you to check out what they're doing, because they've really come up with a nice model. And they call their model the pragmatic experiential therapy. And again, they have a lot of stuff on their website that'll give you an idea of how they operate. So in sum, Gottman, Johnson, and Atkins have all moved their therapy in the direction indicated by affective neuroscience. That is the study of emotion. Now, the research I've done at Iowa State University, but prior to going to the University of South Alabama, we have deliberately tried to incorporate neuroscience into our approach to therapy. And our lab at South Alabama is well set up to do that. We have, I call it our $1 million room. We have all this equipment. We can bring couples in, hook them up to all this equipment, and monitor what's going on in their bodies as they try to deal with one another. Now, interestingly, I think I've mentioned, I am a lecturer for the Institute for Natural Resources. It's a multinational organization that provides training, continuing education training for health and mental health professionals. So INR approached me recently and asked me to develop coursework for them rather than just webinars like I usually do. I usually do 6-hour webinars for them. They've asked me to develop an entire curricula that would be offered online that would train people in couple and family therapy. So I'm working on that with them. And my colleague at the University of South Alabama, Shelley Tremblay, the chair of the psych department, who is a world-class neuroscientist, he and I are working together to put this program together, this training program together. It will be a certificate in marriage and couple and family therapy. That's what we're trying to teach online, but we're basing the whole, as much of it as we can, on neuroscience. So the kinds of things I've been talking about last time we got together and today, we'll be incorporating all that into that training program as it develops, and I can keep you posted. And that would be good for people trying, let's say you have a master's degree in social work, but you want to become a marriage and family therapist, couple and family therapist. Well, the certificate program would allow you to get dual licensed. Okay, so other things that we do in affect-based couple therapy, let's have, I have a little time. I want to walk through how affect-based couple therapy looks different than the typical couple therapy that you may have been trained in. So during the course of therapy, as we start to work with a couple, we very carefully observe their behavior. And we ask them about feelings and thoughts that they have, because we're trying to figure out what primal emotional circuits are driving their behavior. Is it curiosity and joy and caring and lust, or is it fear? Is it anger? Is it panic about not having a relationship? Those are very different ways to enter a relationship. So we're trying to move people towards the 4 positive affective circuits and away from those negative circuits that can be so deleterious to a relationship. And we use the communication rapid assessment scale heavily in our work. All the couples we work with, all the families we work with, we give them copies of the communication rapid assessment scale so they can take it home and read it. And they'll read it and say, oh my God, we're down here in -1 or -2. We should be up here in +2. It's a highly reactive instrument. That is, you read it and you can recognize yourself immediately. I'm doing this, but I should be doing this. I'm doing these good things, but I'm doing these bad things. So we share this with couples and we help them learn to change how they behave towards one another. So if a couple comes in and they're seeking expectancy circuit, their curiosity and their caring circuits are activated, they're going to feel very closely connected to one another. And typically they're not coming in for marriage counseling, they're coming in for relationship enhancement. They want to make a good relationship even better. Those are real fun couples to work with. They're very easy to work with because they already have a good relationship going. So we might occasionally make some suggestions, but for the most part, we just tell them, hey, you're doing the right thing, just keep doing it. But if a couple comes in and we're seeing -1 or -2 communication behavior, what they'll be, as we ask them, what's it like to be in this relationship? They'll talk about feeling very anxious, fearful, angry, and rage. And when we have them hooked up to our monitoring equipment, their heart rates will be very high and they stay high. They don't vary. Their heart rates just stay high all the time. And their pupils will be very dilated so that they can see their potential, this angry partner, the potential enemy out there. They're showing all kinds of physiological activation that tells us that their rage, fear, and or panic circuits are up and running. And if one or more of these circuits are up and running, that relationship is hurting. We need to do something to move away from these circuits being operated to the positive circuits being operated. So if we have these kind of couples coming in, it's important to stop them and take what we're saying to a process level. That is, we talk with them about what we see and hear them doing. We show them what their bodies are doing. We show them how their hearts are racing, how their stress hormone level is really high, how they're not getting any of the good stuff out of a relationship. Their body is reacting as if the body is in danger. That's not good for a relationship. So what we'll do is help the couple become very aware of what's happening inside their bodies, what's happening inside their brains, and then we'll help teach them what they can do to interact with each other differently. So people like Brent Atkinson and Sue Johnson have done a really nice job of coming up with specific therapeutic interventions and strategies to help this happen. So I would encourage you to check out their approaches. So again, at the University of South Alabama, our neurobiology relationships research program is focused on how to move individuals, couples, and families from negative primal brain circuits running to the positive affective circuits, getting them up and running. And we use all kinds of devices to measure that. We're working with our computer science department to come up with simpler ways for you clinicians to do that. I'm wearing a sport watch right now. The sport watch can measure my heart rate and respiration rate, which is basic information to have. So one thing you could do with couples, which is very simple, is just have them put a sport watch on, and that will monitor their heart rate, which gives you some very important information. What we're trying to do is work with our computer science folks to have some very simple leads to attach to a person's arm, maybe to the top of their chest and their leg, so that we can monitor other physiological processes. Right now, we put 21 leads onto their head, so we can measure what the brain electrical state is. We can measure, and we have a very good idea of what areas of the brain are active at any given moment. And that, combined with respiration rate, heart rate, and their simple appearance, it tells us which primal brain circuits are up and running. That's very important information. And as I mentioned last time, we even hired professional poker players to come into our lab and observe what was going on and teach us how to read tells. If you're a good poker player, you can tell when your partner's, when the person across the table from you is excited or when they're anxious. And these poker players were very good at helping us correlate the behaviors that we can see in individuals on the surface of their body with what's going on inside their brain. So I've learned to watch my couples and family members very closely. I watch their frontalis muscles here in their forehead to see if they're tightening up. I watch the large blood vessels in their necks to see if they're becoming enlarged. I watch their bodies to see how their bodies are posturing. If you go to the communication rapid assessment scale, there's a verbal form and a nonverbal form. The nonverbal form describes in great detail the body postures that people engage in. If a person is leaning forward about 15%, had their eyes focused on their partner and their hands in front of them open, that's a dead giveaway. That's a tell that their seeking curiosity circuit is up and running and their care and nurturing circuit is up and running. If they're sitting like this and leaning back and glaring at their partner, that's a dead giveaway that their rage anger circuit is up and running. If somebody's going like this, it's probably their fear or panic circuit. So we train all of our therapists to watch these things and to rate what they think is going on. And then we compare that with our physiological measures, which tell us exactly what brain circuit is up and running. We can measure those brain circuits in our lab, but you can't be hauling all this equipment into your counseling room because it gets in the way. So in our lab, we can do that. But what we've tried to do is train our therapists to watch what they see the partner's doing, hear the tone of voice, and that can give you a lot of information about what's going on at a physiological level. Now, a lot of you folks probably intuitively do that already, but you may not understand specifically what's going on in the brain or central nervous system or endocrine system of your clients. Once you understand what their bodies are doing, you've got a lot more information to work with than you would otherwise. So again, I get the most difficult couples referred to me, the couples that everybody else has given up on. And it's my job to read them accurately. And if possible, I hook them up to my equipment, but a lot of times I can read them without having to go to the equipment because I've been doing it for so long. Okay, we are up, I have 12:58 your time. I'm going to shut up for now because I imagine you'll have some questions. Let me go here. I want to see, this time I'm going to write down which slide we're on. We're on slide 212. No, that's not where we are. How did I get down there? Let's see. Where did I just leave off? Okay. All right, we're gonna. I'm at slide about 231. All right, so I'll shut up, let you ask questions, and let's see if I can find. I'm not seeing Q&A on my screen here.